Thank you, Mario. Thank you, Nicola, for the introduction, and thank you to Sport Physio Suisse for the invitation today. I'm so grateful to be here. I'm Simona Lucarno, sports scientist, and actually I'm working as strength and conditioning coach for FC St. Gallen women's first team. But now let me introduce our first great speaker. Visionary scientific director of Isokinetic Medical Group and powerhouse in sports and football medicine. As president of the Isokinetic Conference and an active member of many scientific societies, including FIFA Medical Center of Excellence Advisory Group, Dr. Francesco Della has become a pivotal figure in the field bridging science and clinical practice on a global scale with a relentless focus on ACL and football injuries. I'm grateful and honored to introduce him to this prestigious conference. Herzlich willkommen. Welcome in Bern, Francesco. The stage is yours.
Wow. Thank you very much. Thank you very much, Simona. It's a pleasure for me to open the conference. And first of all, I'd like to really thank the whole organizing committee. Thank you, Nicola. Thank you, Mario, for the kind invitation. For you, this is important because it opens opportunity of networking, of knowledge generation, confrontation. These conferences are the key for success in the future. So my duty today is to speak about ACL injuries through a neurocognitive lens. But first of all, I would like to spend a few more words on Mario. A special thanks for Mario, because Mario is not only a great scientist, a great clinician, he's a great human being. He's a great friend of our group. So I want to thank you, Mario, and please a big clap for him. I have been already introduced. Just to give a few more words, I'm a sports medicine physician, so I'm not a sports physiotherapist, but I'm engaged in knee injuries, biomechanics, movement analysis, so things that we are all passionate about. This is our group, the Isokinetic Medical Group. We are a FIFA Medical Center of Excellence. We have around 10 centers in Italy. Now we'll open in Greece and in London. We have one campus, and every year we organize a large international conference. This is our campus, and I suggest you to engage with us if you want. We are completely open to visitors, and you see that we dedicated a large part of the campus to this green environment, to facilitate, again, knowledge generation and dissemination. And this is a peak of our conference, and in the future, maybe this is a good opportunity for you to share your view, to bring your experience, and to join the football medicine community. But now back on the topic, so ACL injuries. Now there is a video, so I will show you a video. Please try to focus on something. So this is, I would say, a classic non-contact, complex knee injury in a professional football player. But the problem of ACL injury is that we can see these injuries by many points of view. So the first time that I've seen this injury, of course, I look at the right knee, where practitioner, this is completely normal. But there are many points of view. First of all, when do they happen? Actually, we discovered that they happen in the first part of the match more frequently, and not more frequently towards the end. So ACL injuries or this kind of injuries are more likely to happen in the first run, not in the last run. Then the injury mechanism. We know that it can happen with non-contact mechanism, with indirect contact mechanism, or with direct contact. And vast majority belongs to the first two categories, so non-contact or indirect contact. But the interaction with the environment is important, so we like to speak about this term, situational pattern, that is not just the action, but is the interaction with the environment, defensive playing situation, offensive playing situation, that determine with an indirect or non-contact then the biomechanics. And of course, we like to speak about biomechanics. We love the role of the trunk, the hip, the foot external rotator, the dynamic knee valgus. But we can also now focus the tibiofemoral joint biomechanics with a level of detail that was unprecedented and maybe impossible to think few years ago. But today we'll not speak about these aspects, or just a little bit. We will speak about the context, because if you remember video, you can recall that there was a deceiving action of the opponent just 200 milliseconds before the initial contact to the ground. So the context and interaction of the context is very, very important. So now we'll start with the video, and it's not a video about human beings, it's a video about animals. So this is the phenomenon of murmuration of the starlings. The starlings are little birds that we've seen in Italy while they get through south, so from north to south. You can see how they belong to something bigger. See, this is an adaptive system. So every bird is coordinated with the 9 birds that he has around in order to create this spectacular view. But they do it for a purpose, and the purpose is to escape from the bird of prey. So let's try to think about team sports and teams as adaptive systems that are working to score a goal in order to defeat the other teams. So the athletes never perform movement in isolation. They perform movement in order to reach something. And look at this action of this Manchester City versus Arsenal a few years ago. Look at the amount of stimuli that these players are getting from the environment. It's impressive. And look at the team that is moving just a little bit like the swarm that we have seen before. And eventually, you can score a beautiful goal like this in football. And the single player attention is always on the context. So we have seen the swarm, we have seen the action, but then look at the single player. And this is thanks from Axum and Jordet. This is a video that you will see also with Dustin presentation. Look at his focus. It's not on the knee. It's on the context. It's on the ball. It's, of course, on the performance aspect. So think about this kind of aspect. And, of course, we are getting outside our comfort zone of biomechanics. So look at this injury again. This injury, and you can see very well the interaction with the environment. There is a deceiving action, and there is then something happening. The brain of the defensive player was trying to predict what's going to happen, and he did a mistake. And then the mistakes then determine a very important injury, as it can determine a goal. It's exactly the same thing. So we can see these ACL injuries also through a neurocognitive lens. So today, presentation outlined, we will get through the non-contact ACL injuries in football, which is, of course, the main categories for the neurocognitive perturbation and neurocognitive aspects. Then ACL injury through a neurocognitive lens with the example of football ACL injuries, and we'll speak a little bit about hardware and software interaction to sum a little bit everything up. So in football, there are 2 important aspects of ACL injuries. On one side, there is a mechanical perturbation. These are perturbations that happen generally in the upper part of the body, and this belongs more to indirect contact injuries. On the other side, there are neurocognitive perturbations. The neurocognitive perturbations are distractions that can happen few milliseconds before the initial contact to the ground. So they happen before the player touching actually the ground. In professional football, these are the numbers. So 44% of the injuries are non-contact in nature, and this is very, very consistent across studies that we have done on very large cohorts. It arrives to 54% in female football, and probably in youth football will be around 65%. Then there is another 44% of indirect contact and just 12% direct contact injuries. So today we will focus on the blue segments, on the non-contact injuries. But remember, these are not all the ACL injuries. It's 44% of all the professional football players' ACL injuries. And if we take these non-contact ones, you can see that 75% are defensive in nature. And this is a very important piece of information because football is completely different from other sports. When you have a ball carrier in rugby, basketball, handball, generally you have offensive injuries, 75% offensive. But in football, it's different. So it is a good sport in order to study the reactive ACL injuries. And these are the patterns. Pressing constitutes the 58% of all the non-contact injuries. Then there is regaining ballast after kicking, landing, and other non-contact patterns accounting for the other roughly 40%. And this is only pure non-contact injuries. And of course, this is the biomechanics. We know that there is a very consistent biomechanics, even if there can be some variability. But we know that when they touch the ground, generally the hip is abducted, the trunk is ipsilaterally tilted, and this creates the basis of high knee adduction moment, and then the body kinematic response. So this internal rotation pattern with the trunk that is homolaterally tilted but rotate contralaterally, the tight follow, the tibia is abducted on a planted and externally rotated foot. And of course, when you think about this, and there are 30 years of research detailing these mechanisms, we know that neuromotor training, targeted neuromotor training can be an answer to create athletes' robustness, neuromuscular robustness. And these are some images from our collaborator, Matteo Zago from University of Milan. And you can see very well that at the initial contact with the ground, we have this situation, and then we have an increase, and we can detail and objectify this in knee abduction, so in valgus, and then you have a transition from external rotation to internal rotation. Okay, but the real question is, what happens prior to the initial contact to the ground? So if you rewind a little bit, look at this minus 200 milliseconds, which is the context. The context is that the team is losing. This player has just lost the ball on the left corridor and is pressing in high intensity in order to recover the ball. You can see very well that the injured limb is already off the ground. So the limb that will get injured is the right one, is already off the ground. This is very important in non-contact ACL injuries. And there is a deceiving action, a simple deceiving action from the opponent. The player reads this deceiving action, and then there is an adaptation. The adaptation pre the initial contact to the ground generally determine a hip abduction and a trunk tilt. And then this happens. So we wonder if we apply a neurocognitive lens, and the first one that asked me this is our good friend Harley Gokeller. What if we apply this lens to this whole bunch of videos that we were analyzing? So, yeah, as you can see, this is the first concept paper, anterior cruciate limb injury mechanism through a neurocognition lens, implication for injury screenings. And what we wrote on this paper is that the neurocognitive errors may contribute to ACL injury causation. And in fact, we found the neurocognitive errors, and they are common in non-contact injuries. So in the first study, we studied 47 consecutive non-contact ACL injuries in professional football players, and we studied inhibitory motor control and attentional inhibition. So basically, in pressing injuries, we found poor inhibitory control, so poor decision-making with very aggressive playing style in 92% of cases. And the trait of the player is also important. And deceiving action in 73% of cases, happening 256 milliseconds before the initial contact to the ground. So actually 1/4 of the second, when the injured limb was already off the ground. So our hypothesis is that the motor plan is already in action, and then there is a disturbance, this neurocognitive perturbation. And we found a very similar results in the other non-contact ACL injuries with a shift of visual focus immediately prior the ACL injury itself in 76% of the cases. So, in other words, a distraction immediately before the injury was present in 3 injuries out of 4 of these non-contact ones. And then we repeated the study on Spanish football, and basically, look, it's very consistent. the distance between the perturbation, the distraction, and the initial contact to the ground is very consistent across these two studies. So all merged together, there are about 100 non-contact ACL injuries. In the first study, it was 256 milliseconds. In the second study, it was 240 milliseconds. So basically, just nothing, 1/4 of a second. So the pressing ACL injuries, and these are some of pressing ACL injury, is a typical model to study the neurocognitive factors in non-contact ACL injuries. Look at this pattern. There is always a distraction, and immediately before the initial contact to the ground, during high-intensity decelerations. Look at this one. Deceiving action, the player arriving, decelerating, and the injuries happen. And look at this one again. So when you show these injuries to coaches, and so you hear another voice that contaminate our practice for sure, they told me that these are all mistakes, all technical errors in their opinion. And look at this last technical error. The very last step, something happened. Look, there is a very, very easy adaptation that determines the injury. So if you look at the frame, the injured limb, the right one, again, is already off the ground. Then there is an adaptation to an easy deceiving action. And look at adaptation. You see that the trunk is moving ipsilaterally and the hip is in abduction. Then the initial contact to the ground, it's already gone. At the initial contact to the ground, this is a point of no return. And then there is the injury frame. So again, pressing injury is the best model to study this neurocognitive aspect because it's a purely defensive, reacting, non-contact pattern. And there are two aspects that we can dig in. One, aggressive playing style with lack of inhibition. This is both a trait of the player and a state in the specific situations. So many times the team with the injured player is losing, and this is an attempt to press at high intensity. And then the second aspects are this neurocognitive perturbation. Let's look at some examples. Look at this very intense pressing of the player arriving. And look at the second example here. This is probably the best example ever in order to see what we are talking about. And now I'll show you again the first video. But look at this video not with the biomechanical eyes. Look at it with the neurocognitive lens. You see the deceiving action? Is crystal clear. So what we hypothesize is that the football players generally get a lot of information from the environment, always hundreds and hundreds of information, and they are very good actually in perceiving that, and then integrating through neurocognition, so through higher function. And then they select the motor action. But then when the motor action is already selected, the limb is already off the ground, something happened, another information that deceive our player. And then in order to change the movement pattern, you have to inhibit the motor action to execute a new one. But unfortunately, there is no time because the ground is arriving. They are just a quarter of the second. And so if we look at the video in the different frames, you see again injured limb off the ground. There is a deceiving action, 200 milliseconds from the initial contact to the ground. And then there is an adaptation, and then the initial contact to the ground. And the injury itself. We like to study these videos to cut in pieces the whole injury. But however, this whole process is very fast. And this is real-time speed. So these injuries are not easy to prevent. This requires a whole movement to study how to do it. And this is an example on women football also. Look at the deceiving action, the adaptation with the head that rotate internally, and the injury itself. So again, injured limb already off the ground, deceiving action, adaptation, you see the biomechanical adaptation that gets to the initial contact to the ground. And with the other non-contact injuries, no pressing injuries, we found, for example, in regaining bust after kicking, heading, and other non-contact patterns, we found a sustained attention on the ball with a shift of visual focus immediately before the injury itself, with the potential lack of visuospatial unawareness just before the initial contact with the ground. Look at this injury. He kicks the ball, then he changes point of view, visuospatial unawareness, and then he lands awkwardly, and he has the injury. Over there. Second example, shift of visual focus immediately after the touch of the ball. Look, shift of focus and then the injury. And the last example are these offensive injuries that are driven by mistakes. So mistakes of the ball carrier, mistakes, adaptation, injury. This is a patient of ours, mistake, adaptation, injury. Mistake, adaptation, injury. So in other words, and I echo my friend Dusty Groom's words, these injuries may be considered also as sensory motor errors in complex, high-demand scenarios, as professional football, for sure. But other team sports are similar. So in other words, it's all about hardware and software interaction. And the software is the central nervous system, is the brain, the hardware is the musculoskeletal system, of course. And look at this video from female football, women football. So high-intensity deceleration, the injured led already off the ground. This is a decision of the software. Then reads the goalkeeper behavior, simple deceiving action, and force the hardware to adapt with the trunk tilt and the hip abduction, and then there is a typical internal rotation pattern. And one of the last video, probably one of the most informative one, look at the deceiving action and the adaptation. So if we needed to recap a little bit everything, we really think that it's about hardware and software interaction. So the player decides to press at very high intensity. This is a software decision. You can always also not take that decision. It's a decision. The player then is performing a high-intensity deceleration, so the hardware is doing what the software commanded. Then perceives the context and adapts to neurocognitive perturbation. And again, the software decides, and this is a bad decision, to change the whole body kinematics with high-risk lower limb positionings. And of course, at initial contact with the ground, then athlete robustness gets into place. And so, of course, neuromuscular factors, biomechanical factors, strength of different segments, the technique of the deceleration and change of direction can also change. So it's not just about neuroscience, it's a mix of neuroscience and biomechanics. And this, I promise, is the last video. Look at the chaotic environment of football. Look at this chaos. So at the very end is the number 11 with the red jersey that experienced the injury, but actually it was very chaotic. Look at the number of information. So for sure, we need to consider these aspects also in return to play protocols. So take-home messages today is, athletes never perform movement in isolation, so focus the context in injury prevention and return to play. Neurocognitive errors are common in non-contact ACL injuries in football, and hardware and software interaction create the basis for these severe injuries to happen. And biomechanical factors, guys, and really suggest this, should not be overlooked because athlete robustness is important. But an increased comprehension of the neurocognitive aspect of ACL injuries is warranted. And probably what we call ACL injury is not an ACL injury. This is a very complex mechanical neurophysiological event. So we need to dig into more details in the future. And again, I suggest you to join our community, and I hope to see you in Madrid. Thank you very much.
Thank you, Francesco, for your so clear, instructive, and passionate presentation. Are there any questions from the audience? Yeah, over there, if I'm not wrong.
First of all, thank you very much for sharing with us your knowledge. I will present, I'm Marco, I'm physiotherapist here in Switzerland, but I came from Spain. And now I would like to know what's your opinion in this case. Neuromodulation, invasive or not invasive, preventing this type of lesion or injuries.
Ciao Marco. Neuromodulation, you means like transcranial neuromodulation? I'm getting...
No. Exactly. There is two ways of neuromodulate NE, local, invasive, or central.
Okay, okay. Well, good question, very deep question. Well, I don't think that this is the answer, to be honest. I need to be completely honest. I think that if we wanna reduce some of these injuries, we need to get back to the roots and understand that athletic robustness or biomechanical factors are the basis. So we still need to do the basics, neuromuscular training, targeted, movement technique is important. On the other side, we are moving on the more perceptual, cognitive, psychological traits and state of the players. In other words, if you have a very aggressive player, and he is a defender or is a defending midfielder, and he has had in the past these kind of problems, with this pattern, you have to tackle a little bit his decision-making process. So I don't think that modulating the central nervous system tissue will change his behaviors. This is a little bit behavioral science applied. I hope that my answer was useful for you.
Yes, but it's mostly, we are talking about the speed of reaction. If I understand in a right way talk.
We are talking about two things. We are talking about how they arrive, and it's not the speed of reaction. So this very aggressive play style, for example, in the pressing injuries, is not the speed of reaction. Then there is a speed of reaction. The speed of reaction is another thing that can be absolutely trained 100% and can be trained with techniques. I think that other speakers will explode this concept. But remember that there is always a threshold. So when the deceiving action is too close, it's better to inhibit yourself to react or to read the opponent behavior before. So again, we are in a gray zone. So I stay with the answer that I gave you before. We can train absolutely these reaction times, but it's not just about reaction time. It's really more about the inhibitory control, especially in the pressing injuries.
Okay, thank you very much.
So Francesco, I have a question from Slido from the audience.
Okay.
How would you monitor neurocognitive readiness in athletes? How to be sure they're ready, in this field?
Tough question. Tough question. To be honest, we are working on that. We are, I think, scratching the surface of science into practice here. There are some domains that you can explore. You can explore reaction time. You can explore the cost of an increased cognitive load on a specific task, and Dustin can explode on this concept very well. And there are many groups all around the world that are adding actually a neurocognitive component, so complexity, to a motor task in order to understand which is the cost of increased complexity. So for example, if you have a player that is performing a change of direction and you have a certain performance metric, like the external knee abduction moment, the valgus loading, whatever you want, the knee flexion, and you have a high cost, so a big change in the motor performance task, adding a neurocognitive load, that this is a patient that is not responding well to an increased complexity. If you don't have this cost, this is a patient that is responding well to complexity. But this is just an example. We are just scratching the surface. I don't have a clear answer, but we can study this together.
Another question from the audience? No?
Over there.
Ah.
Hi everyone, hello Francesco, thank you very much for your insights. My name is Christian, I'm a physiotherapist from Geneva, and I would like to know basically how is there any way to assess these neurocognitive capacities, for example at the clinic? Is there any test, is there something that we can do that for us to understand if our athletes or our patients are at risk or not of having these problems?
Okay. Again, we expand on the previous answers. So echoing a little bit Marco from Italy, the first thing that you can assess, and there are various ways to do it, is reaction times. Reaction times help. So you can assess reaction time, you can assess their performance in complex tasks that also include peripheral vision. There are different boards that you can use to do this. And this is a little bit on the time of reaction, but always think that the lights is not football. It's another thing. Football is another thing. And then you can perform, as I just told, a task, like a motor task, a change of direction, a jumping, whatever you want, with a specific goal, and then you dual task. So you insert a neurocognitive load, you insert complexity. And then you look at the difference between the specific performance task that you looked the first time, strength, movement, whatever you want, the score of the score-based movement profile, whatever you want, and you see the difference. If there is a huge difference, you have a high cost of added neurocognitive complexity. So these are the things that we can do, or at the best of my knowledge, this is the best answer that I can give you. Reaction times, and you can buy some device that help you in this, or you can use lights, whatever you want, and on the other side, this aspect. But again, football is football. Lights are not football. Basketball is basketball. Hockey is hockey. So at the very end, we need really to get to the roots of the sport, to recreate specific situation that mimic the sports environment through on-field rehabilitation, through a preventative measures that involve many players and the field. You have to create these situations.
Thank you.
Thank you very much.
Thank you very much, Francesco, once again for your contribution.
Thank you. Thank you.